Welcome to the stream of knowledge.
High blood pressure is a big threat to your health. It can steadily damage your heart, brain, kidney, and eyes with no symptoms. That's why we are going to educate you on a very special topic. And that is hypertension's effects on your body. Let's start. Number 1. Hypertension leads to heart diseases. High blood pressure can cause different heart problems such as coronary heart disease, heart failure, etc. Some studies illustrate that about a quarter of heart failure cases are caused by high blood pressure. Now the question arises, how high blood pressure cause heart failure? Hypertension will make arteries less flexible and cause fatty substances to block blood vessels, which indicates smooth blood flow to the heart becomes impossible. At that time, the heart needs to make the left ventricle work harder and pump blood to various organs. Therefore, to protect your heart health, it is essential to control blood pressure. Number 2 effect is, hypertension can damage your brain. High blood pressure can cause transient ischemic attack, stroke, dementia, mild cognitive impairment, and other brain diseases. Let's see how. Raised blood pressure will block arteries and limit blood reaching the brain. The brain could not function when it is short of blood supply, leading to transient ischemic attack or TIA. This TIA is a warning signal of stroke. Except for TIA and stroke, high blood pressure can also result in vascular sclerosis of your cognitive area. That means patients can be affected with cognitive impairment and gradually may develop into dementia. The treatment of hypertension has been proven to reduce the risk of dementia and cognitive decline effectively. Therefore, it is important for hypertensive patients to control blood pressure for brain health. Number 3 effect is, hypertension will cause kidney problems. Kidney and blood pressure are closely linked. The blood carries metabolic waste through the kidneys. A healthy kidney filters about half a cup of blood every minute. Discharging excess water and metabolic waste is urine. Therefore, the kidney is full of blood vessels. When the blood pressure is high, the walls of blood vessels will thicken in order to resist the excessive pressure. The price of this change is that the blood vessel becomes narrower, which is not conducive to the filtration of wastes. Furthermore, even the basic blood supply to the kidneys cannot be guaranteed. It leads to ischemic atrophy of the kidneys, chronic kidney disease, and the development of renal failure over time. That is the reason why high blood pressure is the second leading cause of kidney failure. Number 4 is, hypertension affects eyesight. Extreme high blood pressure will cause swelling of the retina. Patients will experience blurred vision or even loss of eyesight. The retina is at the back of the eye and functions image focusing. When the blood pressure is too high, the blood vessel walls of the retina will thicken and make the blood vessels narrow. Over time, high blood pressure can damage retinal blood vessels, limit retinal function, and put pressure on the optic nerve, causing vision problems. If you have any question, do comment. You can recommend us any topic. Thank you for watching. Do subscribe, like, comment, and share.